In health news now, about 31 million Americans suffer from chronic sinus problems, affecting their ability to breathe, sleep, smell, and taste. Most people are familiar with the stents that doctors use to treat heart patients suffering from clogged arteries. Well, now that same concept is being applied to clogged sinuses. It's an idea that's helping some patients breathe easy for the first time in decades.
Nope, none whatsoever.
64-year-old Mike Whitty says it's been a long time since he could breathe through his nose.
College. When I was in college, I started getting some sinus issues. Wound up doing the nasal spray thing.
Through the years, it only got worse.
I was a professional tennis player up until I was 30. And so throughout that whole time, it was never breathing through the nose. It was always breathing through the mouth.
His chronic sinus problems made sleeping difficult. And frequent flying for business downright painful.
I would have to sit in my seat and just hold my face or have a hot compress on it.
Now, this is a scan showing some of Mike's sinuses, all of which were obstructed by polyps, mucus, and other inflammation. Now, this area here, for example, is the maxillary sinus. It should actually be all black with air. Instead, this area right here is the only.
Within the last 2 years, it got to the point where it was 24 hours a day, 7 days a week. I just couldn't breathe.
He turned to ear, nose, and throat doctor Daniel Rontel, who offered him something beyond traditional sinus surgery. It's a stent device called the Propel implant.
We perform our normal sinus surgery, open up the sinuses widely, let the air in, remove the polyps, remove the infection, and then afterwards we place this device into the sinuses.
As this animal goes, after doctors clear out the sinuses, they position the stent. It props the area open and slowly releases a steroid called mometasone to reduce scarring and inflammation. After 5 or 6 weeks, the whole device dissolves away.
Patients typically don't even know that it's there. They don't feel anything in there. We're treating the disease right at the source, as opposed to swallowing the pills or having an IV that gets dissolved throughout the whole body. Here we're treating right at the spot of the disease. And so the studies that have been done on this device show that it reduces the need for further surgery up to 30%.
The device is an option for patients suffering from chronic sinusitis. That's more than 3 months of symptoms, including facial pain or pressure, nasal congestion or discharge, loss of smell or taste, headaches, fatigue, and depression. Mike had the surgery in January.
But once I had it was just like night and day.
He's breathing properly and suddenly smelling things he didn't realize he was missing, good and bad.
A lot of stuff come across as a lot more pungent. Taking the trash out and throwing it away. You can smell the trash a whole lot more now. I wish I would have had it done a long, long time ago. I wish I would have had it a long time ago. It's just nice not to have to worry about breathing any longer.